Hello and welcome to Therapeutic Interventions with Individuals. This is going to be the Chapter 1 Introduction and Overview. So, what are you going to learn in this course? You're going to learn some basic helping skills. A lot of that is going to be covered in Chapter 2. You'll also, in Chapter 3, we'll be talking about ethical practices. And then the bulk of the class is going to be on understanding human behavior through theoretical frameworks. So, that's going to be chapters 4, 5, 6, 7, 9, 10, and 14. Chapters 4 and 5 are going to be on psychodynamic approaches. Chapters 6 and 7 are going to be humanistic, which will be existential and person-centered. Chapters 9 and 10, 9 will be on behavioral and third wave cognitive therapies like mindfulness. And then chapter 10 will be on cognitive approaches. And then the final chapter will be on family systems. So chapters 4, 5, 6, 7, 9, and 10 will be about the individual, and family systems will give you a framework of looking at the family and how the family environment can shape personality. One of the questions that we get in this course is how long does it take to become a therapist? So some of you taking this course may only be interested in doing case management work, but some of you may be interested in getting your master's degree and becoming a therapist. So how long does that take? So if you get your bachelor's degree, CCRI is associates, that's 2 years full time. And then if you go to get your bachelor's degree, that's an additional 2 years. So that's 4 years total to get your bachelor's degree. And then your master's degree is another 2 years. So it's about 6 years total in education. One asterisk to note on that is if you do go into a social work program, Rick's Master's of Social Work program, there is an opportunity for students who have a high GPA to apply for the accelerated program, which means that the master's degree is 1 year instead of two. They also have advanced standing, which is similar, where the master's program is 1 year instead of two. If you do the counseling programs, then it's going to be a 2 years master's program. But some of the social work programs, if you have a bachelor's degree in social work and a high GPA and experience working in the field, then you're eligible for this advanced standing or accelerated master's program. Once you graduate with your master's degree, you will then start to work on your license in the field. And so that takes about 2 years of working full time, getting professional experience. And then during that time, you will also need to be supervised by a person who has the license that you're going for. So if you are doing the counseling track, that would be an LMHC. If you're doing social work, that would be an LICSW. And that clinical supervision takes usually about 1 to 2 hours per week to get the clinical supervision hours. And then after you complete the clinical supervision hours, you can apply with the Department of Health in Rhode Island to take the clinical exam. And if you pass the clinical exam, then they will give you the license, either the LICSW or the LMHC. And then once you have your license, you will have continuing education in order to keep your license. So for if you have an LCSW or an LICSW, that's you'll need 30 CEUs every 2 years. So that's something also to keep in mind in terms of what it takes to become a therapist. When you're looking at helping someone, what do you think is more important to help a client? Do you think it's more important to have theoretical knowledge? Do you think it's more important to have strong techniques with working with client? Or do you think it's most important to be warm, genuine, and non-judgmental towards working with clients? So picking one, only one, which one do you think is the most important with helping clients? So when we look at the research on this, we learn that technique only accounts for about 15% of client outcomes. So So that is about having the right technique. So if you're thinking of like techniques, you're going to be thinking of like cognitive behavioral therapy. There's a lot of technique with cognitive behavioral therapy. There's some techniques with psychodynamic, some techniques with existential, some techniques with Adlerian, some techniques with person-centered. But for the most, CBT tends to have a lot of technique. So that really only accounts for 15% of outcomes. Um, but it's not just being a good person with good intentions. We found that that's also not enough. So to be the a therapist, which most likely to help a client, there should be a blend of theoretical knowledge, technique, and having a caring, non-judgmental approach. And that tends to be the most effective when working with clients, whether as a case manager or even as a therapist. Uh, Gerald Corey is the person who wrote the textbook that we'll be using this semester. There's a blurry picture of him in the corner. And he puts in his first chapter some of his counseling philosophies. So he recognizes that personal characteristics are important, but are not enough. So if you're a warm, genuine person who cares about other people, those things are important. They're assets, but it's not enough to be a good helping professional. You do need to have the knowledge about counseling theories and techniques. You also need to have theories of personalities, quality clinical supervision. All of those things will help with becoming a good helping professional. He also said that helping professionals should experience what it's like to seek help or go to therapy. So that's often in the in-person class we discuss that. Do you think, in order to be a good case manager or a good therapist, that you should know what it's like to ask for help or go to therapy? And oftentimes the answer is yes. So usually yes. And what can happen when you have done the work on yourself, you know what it's like to be vulnerable. You know that when a client is coming in asking for help or seeking services, you can remember those moments of uncertainty or vulnerability when you reached out yourself. So it can help to grow your empathy or keep your empathy towards working with clients. He also believes that helping professionals should not try to cure any psychological issues or ailments, that we're not in the business of curing, but we can help people to grow with some of their issues, but not necessarily cure. That was something that Freud had believed in his time, that he was, the talking cure. But we've learned that it's not necessarily really a cure that is happening for people. And he also believes that helping professionals should not try to change their clients. They shouldn't offer quick advice, and they shouldn't try to solve clients' problems for them. So he advocates for more of a collaborative effort rather than coming in as the expert and trying to solve all the problems. So suggestions for using this textbook, he recommends that when you're reading the textbook to relate what you're reading to your own experiences. He says to apply key concepts and techniques to your own personal life. Develop a style that reflects your personality, and you'll often see as we go through some of the chapters that you can't separate the theory that the person came up with from the person themselves. So we'll explore that idea a little bit as we go through some of them. So develop a style that really just resonates with your personality. And then we do have a feature of MindTap that in MindTap, which is where you'll find your e-textbook, and I'll show that to you in a minute where to find that in Blackboard. But you'll need your e-textbook to write your papers, and also MindTap has a feature where it can read your textbook for you. So in terms of the frameworks and approaches that we'll be exploring, I mentioned before that there's chapter 4 and 5. So chapter 4 is on psychoanalytic, and then chapter 5 is on Adlerian theory. And so those theories and techniques that we're going to learn are called insight-oriented techniques, where you help the client gain insight into their problems. That's usually a strategy strategy that's used a little later on in therapy. When we get to chapters 6 and 7, you're going to see existential, and that those techniques are geared towards helping clients to create meaning and purpose in their lives and to be more authentic. And then chapter 7, person-centered, helps to build rapport with clients as well as helps people feel accepted and understood. So typically, we start with person-centered approaches when working with clients, but we'll get to that a little later on. We're going in order of how a lot of these theories came about versus the order that you would use them. In terms of other frameworks that we'll be working with, we have chapter 9, which is has behavioral techniques. So if you've ever worked with ABA or worked in a group home or done anything with like token economies, that's behavioral. And then in that chapter, they also have he has a section on third wave approaches, which are the mindfulness approaches. So those are things like mindfulness-based stress reduction. It is dialectical behavior therapy, DBT, ACT, acceptance and commitment therapy, mindful self-compassion therapy, mindful cognitive therapies. So there's the third wave approaches tend to be more mindfulness based. And then in that, he also talks about EMDR as well. So that's going to be covered in chapter 9. And chapter 10 will go into cognitive approaches. And both of those chapters, chapter 9 and chapter 10, are about setting goals and learning to manage symptoms. A lot of behavioral and cognitive strategies are about that goal setting piece. So if you've ever had to do a treatment plan and set goals, that's the influence that started in the 60s and 70s that all comes from behavioral and cognitive approaches. And then we're going to skip over to family systems in chapter 14. And that is the only chapter that we'll be talking about that's going to be looking at specifically looking at the family environment and how it impacts their well-being. And chapter 5 with Adler, he does recognize the need to connect with others, and you'll also see that theme of connecting with others in the different therapies, but the family systems really talks about how your family can impact your mental well-being. In the course, there's going to be there's regular quizzes and then there's going to be video quizzes. So the case of Stan, if you look in the corner, you'll see Stan. He's the gentleman with his arms crossed. He is the mock patient, and then Corey, who's doing therapy. So these aren't real therapy sessions that are being done, but they're reenactments of therapy sessions. And so we'll be watching videos with Corey applying the techniques that you learn from week to week, and you'll see those in the video quizzes. To understand Stan's backstory in chapter 1, around page 10 or 12, you'll see where it says like introduction to the case of Stan, and that's going to be his background, his biopsychosocial, where you can get a sense of like who Stan is and his background while you're watching those videos, and that can just be really typically, when you're working with clients, you will either do a biopsychosocial assessment with them, or if they're already in treatment, you'll have access to a biopsychosocial assessment to understand your client's background as well. So those are good to read. Um, so you'll be taking the weekly video quizzes after you watch the PowerPoint lectures, and then after you read the textbook. So you'll take those video quizzes, and then also when you write your first paper and your second paper, you're going to go back and reanalyze those videos and explore more what those techniques are and what you're seeing. So the first time you're doing the video quizzes, that's just to get you familiar with it, but then you get to really explore more in depth on what's really going on in those therapy sessions. In terms of Blackboard itself, we're going to take a moment and just kind of peruse around Blackboard so you can get a sense of where things are and where you can find stuff in Blackboard. So Let me close this out. All right. So when you come into Blackboard, it's probably going to put you in the announcement section. There'll be an announcement in here, welcome you to the course, or if there's any updates or reminders about papers or things like that. So you'll always come into the announcement section. There's also a welcome start here, which goes over the course. One of the things that I want to talk about is that this is a condensed 7-week, fully online asynchronous course. Learning in an asynchronous format can be challenging as therapeutic models are complex, nuanced, and often easier to grasp through discussion and reflection in class. That said, the course is designed to support your learning. If you stay engaged, give yourself time to process the material, you can be successful in this course. But again, this is not the best way to learn this material. So if you find yourself struggling, I do have office hours that you can come to where we can talk about where you can ask questions and talk about some of the concepts if you find yourself struggling with them. Here's just a little synopsis about meeting the instructor. Here's where you can find the syllabus to download. Your grades will be posted here. There should be little comments over here on the right-hand side. And if in your comment it says see notes inside your paper, you should be able to click on your paper and then find whatever notes that are there, but only if you see that. Office hours can be virtual. So Monday between 12 and 1, I'm in Warwick, but I can also send you a Zoom link and we can meet that way. On Tuesdays and Thursdays, I'm in Lincoln from 11:15 to 1 p.m. Also, I can send you a Zoom link during that time, and we can meet in case you have any questions terms of the weekly content, there's 7 weeks in this course, and so each week will have tasks set aside for you that you can look at and click in, and it will tell you it's almost like a breakdown of your syllabus in terms of what to do each week. You can find your quizzes, you can find your discussion boards, all that kind of stuff. You could also click out here for discussion boards as well. So, week 1, there'll be an introductory discussion board. The video quizzes, when you click here, those are where the video quizzes will be. Guidelines for papers will be here, so you can click in these folders to find out more information about your papers. If you want access to your textbook, you'll click in here and then click on this. And then you'll have to put in your email or username, and then you'll be able to get into your textbook. And then APA resources. So the paper is to be written in APA. So, what does an APA title page look like? So an APA title page looks like this. If you're not sure what it is, go to the APA folder and look it up, and then you can follow this format to do an APA title page. And yes, all of this is on one page, all on its own. I know it seems like a waste of paper, but that is how the APA title page is done. There's a bunch of reference guides in here, how-to videos on APA, so you have all those resources. The PowerPoints are also available in here, so in addition to the Zoom recording and lecture, you can grab that. I just have in here the JAA transfer pathway to the RIC BSW program because a lot of students at CCRI tend to do that pathway. So you can click on that and look at the course sequences that are there. And then we also have the library, Blackboard Assistance, and Starfish. So that's just a brief introduction to therapeutic interventions. Welcome to the course, and I wish you well this semester.